Hello ladies, today we're going to talk about incontinence, that annoying condition that plagues 1 in 2 women over the age of 50. Happens when we laugh and we sneeze and we jump and we just cross our legs and hope for the best. Today I'm going to speak to Dr. Mike Shenouda from Géniale in Sydney and also on the Gold Coast. Dr. Shenouda is a laser physician and also a member of the International Continence Society. Now Mike, tell us, why do women still put up with incontinence?
Well, they think it's part of being a woman. They think it's post-babies, it's normal deterioration, and they just live with it. They're used to it because mum has it, aunties and friends, either they talk about it or not, but it becomes part of their acceptance of being a woman. But let me tell you that no incontinence and no leakage is normal.
Okay, so it is a very humiliating condition. We know this, and a lot of women do kind of hide it under the carpet. We also know that in the past, surgical procedures have been the go-to for the severe kind of incontinence, but for most women, it's generally mild to moderate symptoms. So tell us what, first of all, are the symptoms and then what we can do about them.
So mild to moderate incontinence is when you cough, sneeze, laugh and jump and you start to have little accidents. And that's sufficient enough to humiliate ladies, and they hide and they do not go to the gym, or it affects and hinders their life. They don't even play with the children because running after them, it has been a big surge around COVID when they're at home and running after the children. So they just live with it, have pads or not, but it has been a big hindrance in their self-esteem, in their launching into lots of activities in life.
And what about their GPs? Do they tell their GPs?
Well, that's a good question that you raised, because we know that 44% of ladies will not mention that to the general practitioners, whether because they're humiliated to talk about it, whether they take it as for granted that it is part of who I am, and they fear the surgery as well.
Okay, so if you don't want to have surgery, what is laser incontinence treatment that you offer?
Well, laser treatment for incontinence has come a long way, and it's the least invasive. It's a 20 minutes to half an hour simple procedure, and the idea is to rejuvenate the genitalia tissues and the strength of the urethra, which is the pee hole. So it's about getting better control, better strength and control of the bladder when it's needed. So we know that it builds the collagen around the vagina tissue, and that's what is required to get a better control, amongst other things like pelvic floor exercise and control as well.
Okay, so let's just talk about the evidence now, Mike. There is one big study that was reported in the International Journal of Obstetrics and Gynecology, and this was basically a meta-analysis of 31 studies on 531 women. And it found, it concluded that although the evidence is not as established as it is for surgical procedures, it certainly has a lot of promise, and that all of these women had some improvement in their, not only incontinence, but also in their mild prolapse symptoms. So is it possible then that you're saying that this treatment isn't only for incontinence, this is more of like a 1 in 5 procedure, it can treat many different things?
Yeah, there's other studies in 2019, amongst many others from biomed research, about how effective the laser treatment is. I will also call it the organ health. So it can treat uterine prolapse, mild to moderate. It rejuvenates the vagina tissue, especially for atrophic vaginitis, which is dry, thin, inflamed vagina. Can be from menopause or post-treatment of breast cancer. It helps the tightening of the vaginal wall, what is called vaginal relaxation syndrome, and also the full rejuvenation by better vascularity and sensitivity. And what we're talking about today is incontinence.
Okay. And so I know that you also offer in combination this therapy sometimes with a growth factor treatment. How does that work? So they have the laser treatment, and in the same consultation, they'll have the growth factor treatment. Is it a separate treatment, and what's involved in the growth factor treatment?
So growth factor is known as platelet-rich plasma. And this is as simple as a blood, like you have a blood test, and we extract platelets, activate it, and inject it back again into the genitalia to stimulate growth factors and rejuvenation of the whole entire area. So either it's injected around the urethra to give strength to the muscles and build collagen support to the muscles, or injected throughout the vaginal wall for better lubrication, sensitivity, and very well reported that partners come and say it's much tighter vagina.
What about lichen sclerosis? This is a condition which is devastating and affects 1 in 80 women. Tell me how this treatment can help these ladies.
So growth factor injection is rejuvenating the skin and the cells of the vagina by inviting new young cells. And it also proved to suppress the autoimmune response, which is the mainstay of the actual disease. So we're getting a healthier vagina tissue and less bleeding and stronger tissue that doesn't tear. And obviously the biggest concern is pain during intercourse because of the fragile vagina tissue. Now, 10% of ladies with lichen sclerosis will have cancer of their vagina. Suppressing the autoimmune response and using the growth factors or platelet-rich plasma, there are studies showing that there's a decrease in that percentage of developing cancer of the vagina.
Okay, well, thank you very much, Dr. Mike Shenouda from Geniale in Sydney and the Gold Coast.